Everybody okay seeing that?
Yeah, I'm fine.
Yeah.
There we go.
Okay,
Over to you, Ian.
Yeah, great. Thanks, Richard. And good morning, everybody. And thank you for taking the time to attend this webinar this morning. Hopefully, there'll be some value in supporting you to make your applications for the funding that's being made available. Richard's introduced me, so I'll skip the first screen if I can, Richard. That's who I am. And go straight into what my part of the presentation will cover this morning. So as you can see on the screen, I'll be trying to explain to you the rationale and thinking behind the grant scheme. And then having done that, explain to you the themes against which we're looking for applications to be made. And then within them applications, the kind of outcomes that we're seeking to achieve. Okay, next slide, please, Richard. Let's go straight into it. So why is good mental health important? Well, I suppose it sounds obvious, but having good mental health and well-being makes it easier to deal with the different stresses and problems in life. It supports our ability to fulfill our ambitions and dreams, to be more confident, have good relationships with other people, and cope with life's ups and downs. It can, for example, help us to do well at school, in early life, in the workplace as we progress through life, and in adjusting to retirement as we get to the later stages of our lives. It's important, however, that we protect our mental health. Lack of appropriate care may lead to other adverse outcomes. For example, poor health reduces someone's chances of being in employment or finishing school, college or university. People can be marginalised and excluded from participation in opportunities to be physically active, social events and many other aspects of community life. And some people with mental health problems report experiencing stigma, disadvantage and discrimination when accessing services. So I think we all understand the importance of mental health. If we can move to the next slide, Richard, please. I just want to give you a brief précis of the impact of COVID over the last 20 months now on the mental health of our local population here in Liverpool. As a result of COVID, Liverpool residents will be experiencing varying degrees of mental distress. In the long term, if this is left unaddressed, these anxieties and disorders can escalate into more serious situations, often resulting in more complex lives, risk-taking behaviours and poorer life chances. This in itself makes prevention critical. So the King's Fund report that you can see on the screen in front of you is based on findings from previous disasters, which suggests that some 3 to 4% of people will experience post-traumatic stress disorder or severe depression as a result of the current pandemic. A further 15 to 20% anxiety to moderate disorders. But most people, around 75%, will experience transient stress, worry, fatigue, depleted resilience, which is an ordinary response to an extraordinary situation and something from which, with the right support, they can recover. Now, within Liverpool, via Merseycare and the IAP services that are available to support mental health, there's a wide provision of clinical support services that position Liverpool well in terms of its offer of support to mental health for its population. During the early months of recovery, however, which is where we are now, most people will not seek formal help, and many will generally not reach the threshold for accessing specialist mental health services, which would leave some people and their families at significant risk of not getting the support they need. It's therefore essential that a joined-up, quality-assured, neighbourhood-based mental health offer is in place to stem the impact of the pandemic on people, families and communities. Next slide, please, Richard. So there are 7 work programmes that are collectively striving to embed prevention across the life course for our community, with a specific focus on vulnerable families and children and other adults at increased risk of experiencing poor health in the early years of this pandemic. These programmes are the ones that you see on the screen below. And we do have detail relating to each of them 7 programmes, but probably not appropriate for me to go into too much depth about them programmes here and now, other than to say that, as you can see, the 5th one down on your screen highlighted in bold is the VCF grants programme that we're here to discuss today, which is about enhancing the capacity within the voluntary sector to support communities to address this rise in lower mental health problems that I've just described. So how are each of these 7 thematic work streams going about establishing their priorities? But for this VCF grant scheme, we've used evidence evolving from in-depth research conducted by Public Health England. Can you have the next slide, please, Richard? The Public Health England review of the disparities between risks and outcomes has confirmed that the impact of COVID has replicated excuse me, existing health inequalities, and in some cases has actually increased them. Now, while it's not a finite list in itself, I'm sure you'll all be familiar with the triggers for poor mental health on the slide. So I'll just give you a second to look at the triggers on the slide. I think if we just go back one slide, Richard, please. There's some of the triggers. And again, I'm guessing that you guys, who take a sip of water, will be familiar with most of them kind of triggers for poor mental health. Okay. You can fast forward to the next slide that we were on before now, Richard, please. So, having identified the risks and the kind of triggers for mental health, the next stage of our kind of planning process to understand how best to position the grant scheme was then to understand who are the vulnerable groups at most risk of poor mental health as a net result of the COVID-19 pandemic. So you can see there that straight away, the kind of impact stretch across the life course. The slide illustrates the impact on people in a range of economic and employment circumstances as well. So if we move on to the next slide, which is a continuation of this one, please, Richard, you can see further people who, again, are adversely affected by the circumstances that COVID-19 has presented. And I have to say, this list is not exhaustive, and vulnerability will differ across the country and across Liverpool as well. So we know the triggers. We have an idea of what the vulnerable groups are. We then need to establish what kind of interventions are the most effective. So again, Richard, if I can ask you to just move on to our next slide, please. The positive news is that there are a number of public mental health interventions that prevent mental health conditions arising. They prevent associated impacts and actually promote well-being and resilience. Many of these interventions result in economic benefits as well, even in the short term, and have demonstrated a return on investment. Now, the strongest evidence base exists for the following interventions outlined on the slide that you can see in front of you there. Just take a read of that. And then, Richard, if we move on to the next slide, there's some further interventions again that, again, are well evidence-based. Now, you'll see between the two slides that there's somewhere in the region of 15 to 16 different types of evidence-based intervention. There's a whole number of groups at risk and vulnerability that exist. So what we had to do was triangulate the 3 pieces of information that I've shared with you on the slides that I've just shown to come to a conclusion as to how best to position this VCF grant scheme. I think the starting point is to say that there are already a wide range of other interventions successfully supporting mental health improvement across Liverpool that are being driven forward in the other mental health work streams that I alluded to at the top of this presentation. So to avoid duplication, it's therefore important to clearly define the parameters of this VCF grant scheme. And to define the parameters of this scheme, we've taken into consideration a number of factors. Firstly, we need to understand where demand for mental health support is not clearly being met by the other 6 strands of work that I described earlier on in this presentation. Secondly, it's important that we sense test with the sector itself where the greatest areas of community need are. And I know Claire and her colleagues have done some work for us on that. And then thirdly, we needed to identify which interventions either sit within the public health outcomes framework that we in public health are driven by, or alternatively contribute to the direct address of some of the wider determinants of public health, excuse me. So using this criteria, we've identified 4 themes against we'd like to invite applications for funding. So Richard, if I can ask you to go to the next slide, please, just take a drink of water. Okay, the first one, as you can see on the screen, is the mental health promotion in youth outside of educational settings. I emphasize outside because there will be work going on with youth inside of school settings elsewhere within this programme. So why mental health promotion in youth outside of educational settings? Bit of context for you. A survey conducted by Young Minds over January to February, start of this year, 2021, indicated 67% of children and young people believe that this current pandemic will have a long-term negative effect on their mental health. This includes young people who have been bereaved or undergone traumatic experiences during the pandemic, who were concerned about whether friendships would recover, or who were worried about the loss of education or indeed the prospects of finding work. In fact, we know almost a third of young people in the UK experienced poor mental health during the first COVID-19 lockdown alone. And when we talk about young people here, we're defining people from the ages of 10 through to the ages of 25. The second priority that we've focused in on is the address of financial insecurity and debt. Again, some context. And I suppose it's worth saying that whilst on the whole, household savings have risen and debt has remained at the same level since the pandemic for a lot, there is evidence to suggest now that some households, particularly those with low incomes, have run down savings and increased debt since its start. The Office of National Statistics found that by December 2020, so this is 8 months ago now, nearly 9 people at that stage had already had to borrow more money than usual because of COVID-19. And that is likely to continue to have increased throughout 2021. The third priority is the address of loneliness to protect the mental health of vulnerable groups. Unsurprisingly, levels of loneliness in the United Kingdom have increased since the start of COVID in spring 2020. And a survey done between October 2020 and February 2021, which was done by the Opinions and Lifestyle Survey, show that reported number or levels of loneliness have increased to 7.2% of the adult population of the United Kingdom. And that equates to around 3.7 million adults. And then the fourth area, and these aren't really in any sequential order in terms of importance, it's just the way that they're laid out on this slide for you, is bereavement support. The position on this one is that since the start of the pandemic, 1 in every 660 people in the UK have died either directly or indirectly due to COVID. This represents approximately 1 in 6 of all deaths. A range of factors, including the unexpectedness of it, the suddenness of it, the inability to attend funerals, and a lack of people to turn to for emotional support because of social distancing and isolation, have contributed additional complications to the bereavement process. So these are the 4 themes that we would like to invite you guys to be making bids for monies to us for. What I'm going to do now is move on before I hand over to my LCVS colleagues to just talk briefly about the outcomes that we're looking to achieve. So if I could ask for the next slide, please, Richard. The intention is to extend and enhance the capacity of the sector, you guys, to support the number of people experiencing low-level mental health problems. And to do that, we're looking for some specific outcomes. Now, due to the scope of the themes that I've just described in the previous slide, it's proposed that bids will be considered against any 4 of them themes, but it's not expected that any bidder achieves all of the objectives that are outlined in the criteria that you see on the screen now because of the diversity of projects that we're likely to have. However, all bidders should be able to illustrate how the impact of the proposed intervention achieves at least 3 of the outcomes that you see on the screen. What we'll also be interested in is the intended methodology for demonstrating those outcomes, because that should be clearly outlined in your bids, with an indication of which proposed outcome measurement tools you'd be looking to use. And when we move on to the back end of the presentation today, my CVS colleagues will be telling you about the support that they're able to offer if you feel you need some additional support with that element of your submission. Just one final slide to share with you, if I could please, Richard. And this is a bit wordy and a bit harder to read. All the slides are available, as Richard's already said. This is just to give you a feel of how the VCF grant scheme fits with the other 6 schemes that I've already discussed this morning, in terms of the overarching suite of outcome objectives that we're looking to achieve. And you can see from the outcomes that we are specifically looking for from the VCF scheme, how they naturally feed into and complement the wider suite of outcomes that the wider program is seeking to achieve. I think probably that's all I need to say at this point, Richard. So I'll hand back the screen to yourself and you can move over to John, Imogen and Paul, if that's okay.
Lovely. Brilliant. Okay. What I'll do is I'll keep the screen up and I'll ask John and Paula to sort of prepare themselves, get themselves ready. So John, are you kind of ready to take on the next sort of section in terms of the slides?
Yeah, that's great. Thank you.
Wonderful. Bro, all yours.
Okay. Hi, everybody. So what we're going to do just in this section is very briefly have a look at the application process and some of the key points within the guidelines for this particular fund. We're not going to go through all of the guidelines, which are actually available and have been available since Monday on the website. We just want to highlight some of the most important bits of the guidelines for you. Just to bear in mind if you are looking to apply to this. So if I could ask Rich to move on to the next slide, please. Thank you. So hopefully it will come as no surprise to anybody that the application process basically follows this kind of chain. It's a relatively standard kind of application process that we've got for this fund. There is an online application form through our online portal that we're asking all applicants to use if possible. We want everything to be directed through the online form if that's all okay with everyone. Obviously, if you have any problems with our online form, get in touch with us and let us know. But the full guidelines and the application form can be found on our website, which is www.lcvs.org.uk/grants. The application form, again, without going into too much detail about it, if you've ever applied to LCVS before, it will be very familiar to you because it's basically been adapted from other forms that we use for other programs that we run. We are very careful, I think, to make sure that we don't ask confusing questions in our application form. And what we want to know, as ever, is just the who, what, where, when, why, and how of your project. So the questions that we ask are the obvious questions that you would expect to see around things like, what is your project all about? How do you know there's a need? Who will it benefit? What difference will your project make? We ask for like a budget breakdown and things like that. There's nothing too onerous, we hope, or unexpected that will be in the application form. Once you've submitted your application, there is then a process of assessing your applications. What that basically is we take a look through your application form and your supporting information, and we will get in touch with you if we have any questions that we feel will help to make the case, or if we have any questions that will help to clarify any of the points that you've made within your application form. If everything's fine, then we might not need to ask many, if any, questions, but it's all about just ensuring that we understand exactly what you're looking to do and what you're looking to achieve. So once that assessment period is completed, your applications will be submitted to a decision-making committee. They will make decisions on the applications that we've received, and applicants will then be notified of the outcome of the application. If you are successful, there will be standard terms and conditions that will be sent out with the offer letter. Again, this is just kind of usual practice in terms of the grants that we make from LCVS. The standard terms and conditions, again, without going into too much detail, just ask you to confirm that you'll spend the money how it's been agreed, that you'll commit to submitting monitoring returns, that you'll inform us of any changes to spend, so on and so forth. Then, once we've received your signed terms and conditions back, the funds will be released. However, this is a fund where it's paid in installments, and we'll talk about the installments and when they're made in the next slide. But it's paid in installments, and there is interim monitoring as well as final monitoring to complete as well. As this is a kind of pilot fund, we are particularly interested in understanding what outputs, in other words, what things are produced and what changes, in other words, outcomes happen as a result of the projects that are funded. So we will be asking you fairly regularly for updates and for information back about how things are going and what results you're getting, because we want to understand the changes that happen and the things that are produced. Next slide, please, Rich. So in terms of what funding is available, and again, this is all on the website, but just to sort of highlight this, it's grants that are between £15,000 and £30,000 to cover a 12-month programme of activity. Now, you can do the maths on this, but basically what we're looking to fund with the total allocation at those sorts of levels is something between 14 and 28 projects. So 14 to 28 grants will be issued approximately with the allocation that we have. We want to sort of stress that the grant can cover a range of different types of costs. So whether that's sort of running costs of particular activities and projects, that's fine. If it's a proportion of like core costs, that's fine as well. Or if it's just, project delivery costs, the things that will enable activities to happen, all absolutely fine to apply for. One area that we're probably less likely to prioritize are sort of large scale capital requests. So large scale one-off purchases, i.e. things like if you wanted to buy a vehicle, that's probably not going to be a high priority for us. And I think it's on our exclusions list. If you're looking for sort of, large scale refurbishments and things like that, and using the majority of the grant for that kind of purpose, probably not going to be a priority for us. That said, if you wanted to buy sort of small pieces of equipment, or if you need to cover the cost of like resources that can aid the delivery of your project, that will be absolutely fine. But it's nice and broad in terms of the range costs that can be covered. Similarly, it's broad in terms of whether your project is new or existing. So if it's a new project that you're looking to introduce within your organization, that's absolutely fine. If it's an extension of existing work that's working really well, that's fine too. Or if it's kind of like a combination of both. So if it's an existing project with new elements, all absolutely fine. But as we say here, what we're also interested in is the kind of exit and sustainability plan that you might have. Now, we recognize completely that sustainability is a very, very difficult thing to achieve, particularly at the moment. But what we're interested in is your ideas as to how this project might be sustained beyond the funded period. Now, we're not going to be saying to you, you have to prove that it will continue and that you've got money in place and all that kind of stuff. What we're interested in is understanding what your plan might be. So you might say things like, we'll look at other funders that might be able to sustain it beyond the period. It might be that you generate income in different ways through donations or through trading activities or through corporate support or whatever it might be. We want to know what sort of ideas you have to continue your projects beyond this period. As I mentioned before, this grant is paid in installments. So 50% of the grant will be paid up front at the start. 30% of the grant will be paid at Q2, and that will be subject to satisfactory interim monitoring that we'll send out. Paul is going to talk a little bit later on about what we're looking for in terms of monitoring and the sort of key questions that we're going to be asking. And then 20% of the grant will be paid on receipt of the final monitoring report coming into us. Next slide, please, Rich. So just in terms of timescales, as we mentioned, this fund went live on Monday, 6th September, and has been opened for applications since then. The deadline is 2 weeks today, so there's not a huge window to get your applications in. Deadline's Friday, the 24th of September at 5 p.m. But as I mentioned before, hopefully the application form is fairly straightforward and easy to complete. So hopefully you won't have too many problems completing that. Again, speak to us if we can help with anything. And in terms of like notifications, so the deadline's Friday, the 24th of September. Between Friday, the 24th of September and the week commencing the 18th of October, we're going to have assessed all the applications, presented them to the committee and collected the decisions from the committee. So applicants will be notified at some point during that week. And then, like I say, offer letters will go out and standard terms and conditions at that point. I'm now going to hand over to Paula just to talk a little bit about some of the key priorities and the monitoring requirements. Thank you.
Okay, thanks, John, and thanks, Ian, for providing some context for this as well. I'll just go over some of the nitty-gritty now, which John was alluding to there. So some of the key eligibility criteria, so the essentials for applications for this grant fund. It's organisations need to have been established for at least 12 months, and that's of this month, September. What we're looking for is groups who've got a proven track record in doing this sort of thing. We want organisations to demonstrate a minimum and maximum income level there of between £10,000 and £750,000. And we know that that will preclude some organisations from applying, and some really good organisations, but the focus of this is to try and engage with some of the small, medium, really grassroots organisations within the community to get involved and help to improve outcomes for people in their area. We want groups to be based in Liverpool and operating for the benefit of Liverpool residents. Be able to meet one or more of the priorities that were detailed, and Ian went over those. Those priorities and the themes is what we're calling them, is around mental health in youth outside of the educational setting, financial insecurity and debt, loneliness, mental health with vulnerable groups, and bereavement support to help people to rebuild their lives. We want groups to be non-for-profit organisations with constitution, governing documents, etc., and clear charitable objectives. We want to have organisations to have bank account with 2 or more signatories, be able to provide accounts and evidence of income expenditure breakdown for the past 12 months. And again, that's going to a minimum of 12-month track record operating. And they need to be providing with us with up-to-date safeguarding policies for the organisation. That's part of our diligence checks that we carry out here at LCVS, just to an assessment that they are in place, they're relevant, and there's not just a policy, but there's procedures there as well to protect people. Okay, next slide, please. Thank you. The monitoring and what we are expecting, well, as John said before, successful applications will be required to submit their monitoring reports quarterly, okay? And those quarterly reports will be provided on the 7th working day after the end of the quarter that you're reporting on. So once the project is agreed and you get your confirmation terms and conditions, which will be October time, the first report based on that will probably be January, then May, then September, then again the final one in January. Those reports will be linked to the payments as well. So obviously the first payment will go out with the terms and conditions. The second payment will be in Q2 after 6 months, and the final one will be with the final report. Okay. What we're expecting to see in the monitoring is how many people you've worked with up to date and by the end of the project, and that's on a cumulative basis. So we're wanting that updated with each report. So we've got an up-to-date picture of who's engaging. So if it's one-off or on a regular basis, you need to be evidencing that. Again, frequency of service user, that's in that. The total number of people for the reporting period and the total to date who report that 4 of the council key outcomes and wider 7 impact outcomes are being met. And we mentioned the themes, the key themes, those four, but the wider outcomes, and again, Ian mentioned these in his slide, it is in the guidance document, so you can refer back to them, but it's around improving the mental health and physical health, people feeling less lonely, people feeling that they've got more secure accommodation, or they're more economically resilient, better able to manage their debt, feelings of safety and more choice or involvement in their community. So they're the outcomes that we're looking to see evidence from. And obviously, we're also asking for evidence of spend against the budget breakdown in the application, and we will require the evidence of the spend, so receipts, invoices, things like that. Our team here at LCVS are able to support you and help you to evidence your outcomes. So if anybody's got any concerns over that, the capacity building team, including Rich and John there, they can help you to monitor what you're doing, improve your evidence gathering. So if you need any information, please get in touch with us about that. But I think that really covers most of the key criteria. We are going to open it up now. So if you've got any questions that you want to float either to Ian or to us here at LCVS, and we'll answer your questions. So yeah, that's about it.
Brilliant, thank you, Paula. Just stop the screen share there. Some really useful information there. I thought it was nice and clear. But we do have a couple of bits in the chat. So let me just go through to start browsing the chat to pick up on some of the questions. And Ian or LCVS guys, feel free to kind of chip in. I think some of these are going to be quite easy to answer. We've got one question asking about, is this Liverpool City? I assume that's City region or just Liverpool. Does it include the Wirral? Does anybody want to sort of like just give some sort of absolute clarity on that for us, please? Can you unmute yourself, John? Brilliant, thanks.
Unfortunately, this is quite strictly the Liverpool Borough. As this is Liverpool City Council funding, it's funding for the borough. In these kinds of situations, there's always a border that we have to put somewhere, and we have to kind of keep to that border. Sometimes that can be in terms of like income levels, which we've sort of done as well to some extent. Sometimes it's geographically. Like I say, as it's Liverpool City Council funding, it has to be organisations that are based within the Liverpool Borough. So if it's organisations just over the border, even in Sefton or Knowsley or on the Wirral, unfortunately, you won't be eligible for this one.
Thanks, John. I think that applies to the second question as well. If an organisation is based outside of Liverpool City, but they do work and have part of their service user cohort in the city, but others elsewhere, I think that's also right, isn't it? That they would be excluded under this particular fund. Yeah,
I mean, just to add to it, I suppose the other thing as well is that as this is a kind of pilot fund as well, it's obviously it's a fairly sort of limited allocation that we've got. So part of the reason also why we have to put these kinds of borders on the fund is that if we open it up more widely, we run the risk of opening floodgates to, you know, hundreds and hundreds of applications where we end up just having to say no to most. So again, it's obviously a requirement because it's Liverpool City Council funding, but it's also a way of like managing the flow of applications that we receive too. So unfortunately on this occasion, yeah, that would be ineligible.
I am muted. There we go. Yeah, we'll email the papers out. Don't worry about that, Saeed. That's not a problem. We'll also share a link to the recording so that if you want to take a step back and maybe share it with your colleagues internally or with your trustees or volunteers, that'll be made available as well. There's another question around can you confirm the project start date or start of the grant period? Should it be the same as the date that the terms and conditions are agreed?
Okay, is that, have I unmuted? Yeah. Yeah, the terms and conditions will go out as soon or as fast as we can after the decisions are being made. So we're working towards having the grant panel the second week in October. So it'll be the third week in October before all the confirmations go out. So, you know, 1st of November, really, or as soon as possible that the projects can get up and running. The reason why we're asking for organisations to apply who have a track record of doing this is that they are ready and they are able to, you know, implement the project to meet the outcomes that we're asking for as soon as possible. Have you got anything else to add to that, John, or is?
No, I think that's everything. I suppose the only other question it might be worth confirming, Paula, just related to that is what the final date is that organisations need to have spent by. Is that the 1st of November then, 2022? I presume it will be.
Yeah, based on the start date, then the end date will be for the spend will be completion and spend by 1st of November 2022. Yeah.
Brilliant, thank you both. I've got a question around joint bids. If an organisation works closely with a connected group or a partner, what's the view on a joint bid?
I'm happy to jump in and have a go at this one. So in terms of joint bids, yeah, if you're working in partnership with another organisation, that's absolutely fine. I think it's one of those things where we're not sort of, it's sort of one of those things where it depends on the project in a way. If by working in partnership with another organisation, it adds value to your project, that's great. We're not going to be too prescriptive on that though. Like, you know, it's up to you to make a sort of case for your project, and like I say, if working in partnership with organisations adds value, that's great. The one thing I would say is it is one application per organisation. So it's not a case of saying, well, we're working in partnership with this organisation, so can we apply for £60,000? We've got to think about sort of an equitable split of spend between organisations. But yeah, certainly if you feel that working with other organisations adds value and will help you to achieve outcomes, then that's great. But it's not something that, you know, we're insisting upon.
Would we be looking at a single applicant with so you've essentially got a lead applicant with reference being made to the partner organisation, just to streamline the application process?
Yeah,
and could I just add there as well? I mean, we've funded in other grant programs partnership projects in the past, and it's always good to see really partnerships developing and collaborative work, joining things up, etc. But I think in this one, we need to be clear as well, John, is that we can't fund both organisations for the partnership. So we wouldn't be looking to see, you know, one organisation applying for 30 and the other one for 30 and delivering this bigger project. It would just be the one amount for the partnership.
Yeah, that's it. Yeah, that's exactly right. Yeah.
Okay. Well, thanks. Next question, interesting one. I've seen this one before actually. If an organisation has had like a one-off spike in their public donations as a result of COVID, which might have taken them above the threshold, but ordinarily the organisation might not exist beyond that threshold, does that exclude them from the application process? Anybody want to jump in on this one? Paula, I think you're on mute.
There we go. I'll start, John, you'll probably add to this, but we don't want to penalise anyone because they've received some emergency COVID funding, but that is the criteria. The 750 is the limit. So if your accounts show a bigger income for that than that for the year, then unfortunately it will preclude you from applying.
Okay, so at least that offers some clarity. Thank you. Another question here. We're based in Liverpool and delivering to Liverpool residents, but our board of trustees is national. We ring fence all our local funds to Liverpool only. Would we be eligible? I would imagine that would be fine. Trustees don't all live in the same house. And if an organisation is based here in the city, so it has its like registered address, its operational headquarters here. Trustees live in all sorts of different places. Trustees move house, so I wouldn't expect an organisation to be penalised because like 1 or 2 of their trustees live in Manchester, for example. I'm not talking broken biscuits there, guys, am I? That sounds right.
Sorry, the question's been misunderstood. That might be my fault for how I've phrased it.
Absolutely fine.
Our charity is registered as a national charity, but we're tiny and the Liverpool base. We always miss out on all of these funds because of this issue. But our work is, you know, I manage the Liverpool branch and we work only in Liverpool. Everything's ring fenced for Liverpool.
So what is it that defines you as national then, other than your trustees kind of being elsewhere?
We have branches, 5 branches across. I'm saying branches, that makes us sound a lot bigger than we are. We have 5 choirs across the UK.
Right, but your operational headquarters is based in Liverpool.
No.
Right. That might make it an issue in terms of if you're headquartered outside of a particular location. If you have multiple projects and that your projects are kind of some of your projects are in one place, some of your projects in another, and you're registered, I can see why that might be difficult for you. It's just that wherever you draw a line, sometimes somebody's just on the wrong side of that line. And as a kind of a city council led kind of fund, this is very much for kind of the sector that is kind of like located in the city.
The application would be for Liverpool only. It wouldn't be for central funds and it wouldn't be for the other branches. It would be for Liverpool work only, and every penny would be for Liverpool.
We might need to reflect on that, but I'm not feeling positive. John, did you want to kind of like jump in and offer a perspective on that?
I was just going to say, actually, I think it might be worth us having a separate conversation just to explore exactly what the situation is. I think, again, it's one of those things where we want to try and be as flexible as we can be, but at the same time, again, just be aware of like the borders that we're setting and what the rules are with regards to those borders. So I think maybe having a separate conversation might be worthwhile, and similarly for any other organisations that are maybe unsure of that, because there may be situations where it's very clear that an organisation is based in Liverpool and operating for the benefit of Liverpool, but there are benefits that are felt outside of the area as well. And in those sorts of cases, it might be that we can actually support that kind of activity. But I think in a way, what we probably need to do is look at that on a more case-by-case sort of basis. So if we could maybe have a conversation outside of this meeting, and we'll just explore that. The other thing that I would just add as well is that like I'm a funding advisor for LCVS. So if there are situations, if you sort of feel, oh, do you know what, maybe this isn't for us, then please feel free to talk to me as well about exploring other options, because my day-to-day job is helping organisations to identify funding options and helping them to apply to funding options. So if you sort of feel off the back of today, okay, this probably isn't for us, please get in touch with me anyway, and we can have a conversation about what other funds are out there. Okay.
Could I just add as well? I mean, this just highlights the the peculiarities of the voluntary sector, isn't it, and how they operate. I think one of the other questions is around, do you have your own bank account for the choir with no name, and is your funds sort of divvied up like that so it can be ring fenced and things. So as John said, have a conversation outside of this, but it might be, you have to look at some sort of partnership.
Okay, thank you.
Well, thank you. So another question here: if there is a joint bid, would both organisations need to have a minimum of 10,000 in their accounts?
No, sorry, should I answer this one? I would say that the lead organisation would have to have the £10,000 minimum income for the application, and then just reference who they're working in partnership with.
Yeah, I think if the other organisation is smaller, but it offers genuine additionality to the project, we would look upon that favourably, because we're trying to get the best projects funded that we can for this. Okay, I think this one seems to be more of an offer from Phil and Evolving Minds. They would be up for collaboration. They're a Knowsley-based organisation, but they do have a team of mental health nurses. So what I can do, Phil, if you're okay, is I can make sure to share your details if you like.
Yeah, sorry, I pressed return as I was going to come down. The main question was, because we're Knowsley based, there's another question a bit lower down. We're Knowsley based, are we excluded even from partnerships pretty much? Because we do have partner organisations in Liverpool city region, but because we're Knowsley, I just wanted to clarify whether we could or could not be part of any bid.
I think that would be fine. Again, if the lead organisation on the application is a Liverpool-based organisation and all of the other eligibility criteria is met, then yeah, partnering with organisations outside of the area is fine. All I would say is that again, I think we would be interested, shall we say, in seeing what impact the partner organisations have on Liverpool communities. And again, we're really interested on the impact on Liverpool communities. So I think that would be fine. You know, I'll pass it to others for comments as well. But like, I think just bear in mind that the focus is on Liverpool and Liverpool communities with this particular fund.
Yeah, I think that's the difficult bit, because we're Knowsley based, but we're Liverpool city region wide. So we provide support all over the city. It was just that our office is based in Knowsley.
Yeah, it's not an uncommon issue, unfortunately, Phil, is that the lines that get drawn in maps are not often reflective of how organisations work. It's the nature of the beast, unfortunately. Okay, question from Michelle. If a project starts on the 1st of December, would that be ineligible?
Sorry, guys. I wouldn't see that as a problem. There is the question on the application does ask you the start date for your project. We're recommending that project starts as soon as possible after the date that it gets agreed. But that's not out of the question. We are expecting that some projects won't be starting within 4 weeks of the notification that they receive.
Yeah, I agree. I think it's absolutely a sort of flexible start date. I think it's just bear in mind that there will be an end date that probably is more important to meet. So if you're starting later, it might be that you don't have quite as many weeks, weeks and months to actually deliver and spend. But yeah, that's fine.
Thank you. If you're based and operate from Liverpool, and this goes back to the issue we've been discussing already, but you do have some service users from across Merseyside, so a mixture of city-based and maybe Merseyside-based, can only the Liverpool-based service users take part in the project or benefit from the project? This
is a tricky one in a way, because again, I think my answer to that would be, in a sense, yeah, it's almost like I don't see that you would be ineligible from applying, but what we would have to see, I think, in the application was that whatever funding was approved is ring fenced for Liverpool beneficiaries, because it has that focus, unfortunately. So it's one of those where, again, there's ways in which the rules on this might be slightly flexible. But I think if you're based in Liverpool and you have beneficiaries that are wider outside of the Liverpool borough, i.e. in Sefton, Knowsley, wherever, I think you can apply, but it would have to be ring-fenced funding for Liverpool beneficiaries. I mean, again, Paula, I don't know whether you want to comment on this.
No, I agree with you, John. I definitely recommend organisations in this position submit an application, because we definitely consider it for the reasons that John said, but there would be some ring fencing required for the spend. Yeah.
But again, I just to follow on, sorry, I would just also say, if you want to speak to us before you apply, and we can maybe have a chat about what the situation is, it could be that we can sort of talk through this and find a sort of solution that works. So again, it might be worth just getting in touch with us first before you apply, and then and we'll have a chat about that one.
Well, thanks. So this is a bit of a request more than anything, I think, from Karen. Talking about the kind of the wider strategy and the wider issues, it was more of a request, it seems, for group of organizations working in this sector to kind of get together and have a collective voice and share learning. Now, this sounds very much like, Paula, that's your kind of bag in terms of maybe the health and well-being network, and maybe an opportunity to kind of like use that platform as a vehicle for this. I don't know if you wanted to kind of comment on that.
Yeah, definitely. I've just seen that comment. Thanks, Karen. It is something that we've discussed already, actually, within the team here at LCVS. We have got the Liverpool Health and Wellbeing Network group, which is a long-established group and has a set agenda. Mental health comes up with it. COVID recovery has been on that agenda. But I think we need, well, we're considering having, you know, maybe a community of practice around this as well, so that we can share learning, we can, you know, develop more collaborations within it, and look for some sort of sustainability as well for when this project, these projects end. So yeah, we are looking at that, Karen, so I'll be in touch.
Well, thanks. What's the view, positive, negative or neutral, when it comes to match funding in relation to applications, John?
Yeah, I mean, if you've got match funding that can add value to funding that we can offer, that would be fantastic. And if you can sort of show what difference that will make, that's brilliant. Again, we don't want to be too prescriptive about requirements with regards to match funding. So we're not going to say to organizations, you have to have match funding in place or anything like that. But if you have, and you can, you know, use that in support of a, you know, contribution or a grant that we can make to you, that would be brilliant. Just on a slightly different point as well, but it's kind of linked to this. There might be a situation where your project cost is far in excess, or, you know, slightly above what we can actually fund as a maximum. So let's say your project is, you know, £50,000. That's the total cost of your project. The maximum that we can give you is £30,000. Now, again, very rarely do things fall perfectly into place where it's like, well, we've already secured the £20,000. So in those kinds of situations, one of the things that we will be interested in hearing from you on is where any kind of shortfall on a total project cost might come from. So in the application form, there is a table that's just before the budget breakdown that asks about what the total cost of the project is. And if it's more than you can apply for through this fund, where you think the other funding will come from. Now, again, we completely understand that it might be a case of saying what income has been planned for, what income is pending in terms of like applications where you might be, you know, waiting for a decision from a funder, or what income you've secured. That's absolutely fine, but we just want to see what that plan is. The other thing that I would definitely recommend as well is, if, say, your project cost is, let's just say it's £50,000 and you're applying to us for, say, £30,000, somewhere in your application, I think it would be really useful, just find somewhere in the application to put this, whether your project is scalable. So in other words, if you got the money from us, but you didn't get any of the other money towards the total project cost, could it still run? Because, you know, again, one of the things that we completely understand about the voluntary sector is that they are brilliant at, you know, cutting the cloth where needed and scaling down projects and working within budgets that are available. So again, you know, if your total project cost is more than you can apply for from us, you know, detail where you plan to make, you know, meet that shortfall from, you know, pending, planned and secured income. And somewhere in your application, just include a line that says, look, if we don't secure the other money that we're looking to secure, this is what we can do with your funds. Because again, it raises a question if you don't sort of address that in your application. Okay.
Perfect, thank you. Just one more question in the chat at the moment. Slightly broader one from Carolyn. This might be one for Ian, but feel free, guys, to jump in. It's mentioned that this is a pilot grant program. Is anybody envisaging an ongoing kind of program of support for this?
Thanks, Richard. I'll answer this one. The funds that we've got for this particular grant scheme are coming from COVID recovery funds that have been given to public health departments across the country as a net result of what's happened over the last 20 months. And We, from a public health perspective, need to have all our investments in position by the end of this financial year with a view to then seeing what the outcomes are further down the line. So the answer to your question is that at this point in time, we don't have any guarantees of any funding beyond that point in time. So obviously these interventions, as Paul has already explained, are due to scheduled to end in November 2022. At this point, you know, all I can do is be honest with you and say we don't have any further funding beyond that point.
What I would say to that, thanks Ian, is that it really does impress the importance of the feedback and the evidence of impact, but also any evidence that you can gather of ongoing need and future need, so that if LCVS or indeed sort of Ian's team at City Council can make that case, both locally and nationally, to kind of state and other funders, we'd really kind of encourage you to kind of do the evaluation work. And that's why we see it as a pilot as well. We want it to test initiatives to be able to address mental health challenges, but then prove the need for the funding. I don't know if anyone in LCVS wanted to kind of jump in terms of that comment.
I just I just wanted to add that, you know, this is a different model of support in health and well-being, and I think it is the way things are going in the future. In other conversations, you know, you've got the CCG looking at more community interventions, social prescribing models. So it is important that you are producing some really good outcomes. You do anyway, but, you know, if we can evidence them better and show, you know, the difference that these community organisations can make in terms of health, physical health, mental health and well-being in the communities, and how we can help recover from, you know, a global pandemic on a local level. So yeah, it is important, and who knows what it'll open up, but, you know, there's conversations going on constantly about how budgets are going to be devolved, and yeah, I just watch this space really. I can't see things ending, but, you know, what do I know?
I would just add to that by saying, again, one of the reasons you might have been wondering why we were focusing on monitoring at what seems to be a really, really early stage in the process where you haven't even submitted your applications yet. But again, you know, just talking to what Rich and Paula and Ian have just said there, it's one of those things where we want to give organisations as much notice as is possible about what the kind of monitoring requirements will be and the sorts of questions that we're going to be asking, so that even now, as you're planning your applications and maybe submitting applications, you can sort of think about what might be needed in terms of, you know, the tools that you use to actually collect data and what sorts of data we're going to be asking you for. We are asking, as we said earlier, you know, that we are going to be asking for fairly regular updates in terms of how many people that you've been benefiting and in what ways they've benefited and what sorts of outcomes they're reporting. And it's not just about like sort of checking that things are going well. It's about building that body of evidence that can be used to kind of hopefully lever in other money. And again, you know, it's one of those things that if we can all sort of pull together on that, you know, it can lead to much bigger and better things. It quite often does. The other thing I would sort of say is that, and again, it's just leading to points that have already been made, but we don't want to be too prescriptive about the tools that you use. But if you need any help with things like monitoring, talk to us about that, because we absolutely can help you with setting up those kinds of reporting procedures and identifying the best tools for the outcomes that you're looking to achieve. The other thing that I would say just finally is that it's not all about numbers either. You know, it can be about the quality of the interventions that you have with service users and those who benefit within your community. Again, the monitoring questions that we ask will give you space to explore not just the outcomes that we're looking to achieve, but any other like wider impacts or you know, knock-on effects that have happened as a result of your projects.
Could I just add to that as well? Sorry, it's turned into a long answer this, but I think it's really important as well when you engage in this programme and other wider health initiatives, We use the resources that are out there already, you know, like including the Live Well directory. So, you know, if you do apply for this and you are successful, then I suggest that we look at how we use those resources better, just to embed it within the health model, the wider health model, and you're getting referrals from GPs as well as self-referrals, so we can prove that, you know, we are producing outcomes for lots of different clients.
Thanks, Paula. We've got quite a specific question from Susie. Susie runs a therapy telephone line that was set up at the start of COVID. She believes that her project could easily demonstrate at least 5 of the outcomes listed, but she doesn't seem to feel it sits or fits neatly into the 4 priority areas, but she does think that addressing loneliness is the closest match, but she feels that their work is mental health kind of more broadly. She just wants to check that we definitely fit for this grant.
I'd suggest a phone call there, so we can have a chat with you about the details of the project. You know, we can discuss it with you and help you to make that decision.
And that's the same for anybody that feels like they've got a question about eligibility that they don't want to talk about today, or they think, oh, we sound 70% eligible, but I've got a grain of doubt in my head. Contact us and we can talk to you about it.
The only thing that I would just maybe add to that is, and obviously, yeah, we need to have a conversation just to find out the ins and outs of the project. But like, the only thing I would say is that particular priority is probably more than the others a bit more of a catch-all for projects, in that, you know, addressing loneliness amongst vulnerable groups is probably something that can be interpreted in you know, a lot of different ways, compared with something like bereavement support, which is a bit more focused. So in turn, you know, just off what's sort of said there, then I think there is potential, but it is probably worth us having a conversation first.
So who in particular should I call, or is there a general helpline number?
Well, right. I think if you just email us in, please, Susie, at the grants at LCVS, and we'll pick it up from there, or just call just call the regular number and either ask for the grants team or the capacity building team, and we'll pick it up.
Okay, thank you.
Yeah, just for info again, because I know it's not up on the screen anymore. So our general telephone number, general line is 0151 227 5177. So 0151 227 5177. And the best email address to send to would be grants@lcvs.org.uk. So grants@lcvs.org.uk.
Brilliant, thanks for that, guys. So that, I think, brings us to a close in terms of the questions. If you do have any burning questions that literally pop into your head the minute we stop this presentation, just get in touch with us via that email address or the telephone number that we've just described. I will be sending out the slides, and once we've completed the editing, as I said at the top of the event, we'll be able to share this video as well once the recording is all downloaded and edited. What I'll do is I'll press stop on the recording now.